I was trying to say earlier that if your health insurance plan, okay, covers antenatal for you, when your pregnancy is 12 weeks or 13 weeks, which is same as 3 months, it is the responsibility of the hospital, those of us in the HMO department of the hospital, to send a mail to your HMO to approve. Are you following? So if your health insurance plan covers antenatal, your HMO should approve once they receive such a request from the hospital. But if your health insurance plan does not cover antenatal, the HMO will decline. So you have to be on a higher plan, maybe from silver and above, maybe silver, gold, or if you happen to be on the highest plan, which is platinum, then you should be covered for. Yes, you should be covered for antenatal. That's condition 1. Condition 2, it should also be that your status, at your office is not showing single. Some persons are married, but officially your employer, your company, that puts in place health insurance package or policy for you is not aware officially that you are what? You are married. So have you informed your employer that you are married? Because if, as far as your HMO is concerned, they are not aware that you are married, your status is still showing single. Like when you got that job then, it was single, now it is still showing single. Your HMO is not aware that you are married. They will not cover antenatal for you. Antenatal is not covered for, I will allow you to talk. It's not covered for a woman who is officially single. Your marital status is showing what? Single. Even if you are married, though, you have done your marriage formally. If it is church, traditional, you have done everything. But you have not communicated your employer, because it is your employer that should not communicate your HMO. Like you said, it is your husband's HMO, is that correct? So your husband will not be the one to communicate his employer that his wife is married, no longer single. So the HR of your husband's company will now have to communicate that to your what? To your HMO. So if your health insurance plan covers antenatal and your marital status is showing married, okay, your HMO should cover antenatal for you. Then to answer the question you asked, like currently you are not up to 13 weeks, you are not up to 3 months. Your question now is, shouldn't you take antenatal drugs? Is that your question? Is it that they are not important? You have to see the obstetrician, that's a gynecologist. I wouldn't know if he's still in the theater. Like I said earlier, he did the surgery earlier. I wouldn't know whether he's doing another surgery today. So he would be the one to answer that question. Then if the answer is yes, if he says you need antenatal drugs, even if your pregnancy is not up to 13 weeks for you to formally register for antenatal under your HMO coverage, if he says you need it, your HMO will definitely not cover anything relating to antenatal now because you are not up to 13 weeks yet. But you can decide to pay for the medication. So I think you should still wait for him. Yeah, he has been. It is possible to see them, but it's not their own area of specialty. So they are not gynecologists.
So the gynecologists come on Tuesday and which day?
Monday to Friday, except Thursday.
Except Thursday?
Yes, except Thursday. He doesn't do gynae, because Thursday is antenatal day. So because the number of antenatal women, sometimes like 60, 70, so attending to them and also combining with the other aspect of gynae, consult, like women that are not doing antenatal but they need gynae services, the workload will be too much for him.
So what time does it resume?
Yeah, 10 a.m., 11 a.m. Yeah, maybe till say 4 p.m. or 5 p.m.
I will check now if it's there. If not, I'll just have to come back tomorrow.
So you may check again.
Thank you, sir.
Thank you for your time. Thank you for coming. So, thank you for watching my video. I do appreciate you. Really appreciate you. Thank you for watching my video. This is what I do for a living, health insurance consultancy. So you can reach me on WhatsApp. My WhatsApp number is displaying, on this post. You can also contact me to buy health insurance policy for staff of your organization. And finally, you can buy a copy of my book, Practical Working of the Health Insurance System, authored by Osimi Chukwuka. I appreciate your time. This book is also available on Amazon. That's a soft copy of it. Thank you.